Kuna Nini Watu. What's up, people? This is how I look when I go to the grocery store to get groceries these days. I don't have a medical mask, so I use the bandana. Anyway, how did it look? I get a lot of funny looks when I go to Kroger with this on, but hey, that's the time we live in. All right. Anyway, so welcome to the Outbreak series podcast. It's a podcast where I track that darn coronavirus, COVID-19, and it's spread throughout the U.S. and into West Virginia, my state. My name's Taylor, and it's Sunday, April 19th. Already, time is flying. So the last time I spoke to you was a week ago. I apologize for the absence. I know you guys missed me. I was very busy doing, the social distancing and, sheltering at home stuff and everything that comes along with it. But anyway, I'm back, all right? So anyway, I just said anyway twice. Or I just said it 3 times. So as we go, when I talked to you a week ago, the numbers were at 532,000 positive cases of the coronavirus in the U.S. with 20,000 deaths. And then West Virginia had 591 cases. So a week later, let's look at the numbers. I got them for you. Right now, U.S. 763,000 plus confirmed cases with over 40,000 deaths. So last week 20,000, this week 40,000. That's a lot. The hotspot, that's been the hotspot, ground zero for the coronavirus epidemic, New York State, New York State with 247,000 confirmed cases, 18,000 deaths, just in New York State alone. My hometown of D.C., 2,793 confirmed cases and 96 deaths. And West Virginia, 890 confirmed cases, 20 deaths. Man. Question, how's everybody doing? And another question. So would you go back to work? And I'm talking about going back to work, in New York or Detroit or Chicago or New Orleans. If you were a frontline worker and you needed your paycheck to pay bills am I going to go to work? Am I going to quit? They're forcing me to go to work. They're opening up the economy here. So it's been a big debate lately. Some want to open up the economy, get people out there, get businesses open. Others don't. Huge debate. Comment down below if you have any insight or anything to say about that. And real fast, or not real fast, but take your time on this. I want to give a moment of silence for all the people that have lost their lives or been impacted by this coronavirus epidemic. Okay? Thank you. Okay. So, testing for everybody is another big topic. That's what, people want to do. Some people want to do that. Test everybody in the United States before we send people back to work, just to see who's had the coronavirus. I think they're coming up with an antibody test, which they may have already. I'm not sure. So testing everybody, I think it's a great idea, for sure. Our state right beside us, Virginia, has been in the spotlight a little bit. Just today, Virginia had 500 new cases of the coronavirus and 20 deaths. Just today. Their governor, Ralph Northam, is he's getting some criticism. He closed down the state, shut down the state later than West Virginia and some other surrounding states. And people are saying that may have something to do with the little spike in coronavirus cases in Virginia. Trump and the governors been going back and forth. Not even gonna get into that shit. But I do need some of this. Hey Cole, there's my doggy. I need some hand sanitizer. I actually borrowed this from Abby. It was the very last one. That's all I got right there. Been through like 10 of these little things. So if anybody has any hand sanitizer, comment down below and I'll give you my address, because I'm completely out almost. This will last me like half a day maybe. And then I want to talk about the WHO, the WHO, the World Health Organization. Our president actually, I don't know, he's threatened to try to defund or stop defunding the World Health Organization, which he can't do that anyway. That's not his decision. That's Congress's decision. I guess he's trying to place the blame on anybody else but him, on the slow recognition of how dangerous this virus was in the U.S. So anyway, there was a thing on last night where they had all the old school artists performing. It was nice. Watch it over at Mom's house. Good stuff. Check it out. Look up the World Health Organization. Also, I did hear a doctor from Nigeria being interviewed, and I just want to put the coronavirus in perspective for you. I talk about the United States and West Virginia, but the coronavirus has actually impacted the entire planet. Africa hasn't been impacted nearly as much as other areas, but it's starting to see more cases. So they interviewed a doctor from Nigeria, and 25% of his patients have HIV or AIDS. It's an epidemic in many places in Africa. So places like that need the World Health Organization. If an outbreak of the coronavirus occurred in one of those areas, in Africa, it would be devastating, okay? And there are many other areas in the world just like that. So we need to support the World Health Organization. Trust me on that. So, I don't have much substance for you tonight. I just wanted to get back at you. Let you see my face. Let you know I'm still alive. Let you know I'm still with you guys. I'm going to come back tomorrow with some news, some important stuff to say. So tonight, I'm going to end it on this. It's a very serious comment here. So, anyway, here goes. So, is a hippopotamus a hippopotamus? Or is a hippopotamus just a really cool opotamus? I don't know. It's just something to think about. Okay? Alright, love you guys. I'll talk to you soon. Be safe.